to see you. It's fun breeding you.
Okay, welcome back from the break. My name is Nelly Awula-Mensah, and this is Stay Alive. Today we are going to do something really short and sweet, but it's going to be interesting anyway. We are talking about safe and smooth pregnancy and delivery. Okay, and we have Dr. Sefogah, Promise Sefogah from Shape Healthcare, and he's going to break things down with us. So stick and stay, don't go anywhere, okay? Prudential Life Insurance has us covered for the show. Prudential Life, always listening, always understanding. So if you have any insurance needs, like I always say, contact Prudential Life and they will have you covered. Okay. Good morning, Doc.
Good morning.
And you're welcome once again.
Thank you.
Right. Okay. So we are talking about safe pregnancy and delivery. Yeah. What I want to, most of us women don't, because most pregnancies are not planned, you don't find out that you're pregnant until maybe the second or third month, because that's when you begin to worry that you're missing your period. Okay, so can I safely say that there's no telling that you can take care of yourself properly right from the beginning when you know?
Yes, that's a very good observation you've made, and that is what tends to be the scenario here in our part of the world. Okay. Because typically the women do not come forward for what we call pre-conception care, which otherwise is very important. You know, because for instance, if the woman has any medical condition, hypertension, diabetes, which are common, or the woman is overweight or obese, or has sickle cell, or any seemingly unimportant thing to the woman, she would need ideally to be seen, and we make sure she's safe, because some of the medications we may need to change. Right. Some of them are not safe for conception. Some of the time we need to also make sure the condition itself is controlled. For example, if the woman has high blood pressure before and she's on medication, whether the blood pressure is controlled or not, she needs to come. Let's make sure the control is better before she gets pregnant. Right. Why? Because once you get pregnant, pregnancy has a tendency to worsen the blood pressure. So if already it's not well controlled and you get pregnant, things are going to get worse. You know, and that leads on to other major complications of pregnancy, like the preeclampsia, eclampsia we talked about, which can be potentially life-threatening. You know. And then diabetes is also one of the common problems. When a woman is diabetic, it means that the blood sugars are high, just because her insulin is not working effectively to pump up the sugar from digested food. So mostly they are on oral medication to control the blood sugars. If the woman's blood sugars are not well controlled at the time she conceives, there's a high tendency that the baby's formation will be abnormal. Okay. You see? Wow. And so it's very important that when you are intending on embarking on pregnancy journey, have a session with your doctor. Have a quick check, do a scan. Some people have fibroid they don't know about it. We're going to tell you, okay, where it is, it's safe to get pregnant, or there's a likelihood that a pregnancy might miscarry. All of that. Then we can advise you on what to do before the journey begins. Okay. All right. So you meant the diabetes part that you mentioned. There are certain women who also get diabetes during their pregnancy. I've heard about diabetes in pregnancy that goes away after the pregnancy. In a large majority. In a large majority. You think about 100, in about 80 to 85 after delivery, blood sugars return to normal. They return to normal. Okay. For about 15%, it would stay on. It would stay on? It would stay on, but that's the small minority. Okay. And then some of them too, once this happens during pregnancy, it's a warning that this woman is likely to develop diabetes in the future. Okay. Is it because I'm already, for lack of a better word, predisposed to diabetes? Is that yes and then no. Okay. Yes, because if you have a family history of diabetes, then your tendency to develop diabetes in pregnancy, which we call gestational diabetes, is a lot higher than if you did not have a family history, i.e. your mom or your dad. Otherwise, somebody who is overweight or obese stands a higher risk.
Okay.
So some of these can be predictable.
Okay.
And which is why if you are doing the preconception care, we'll say, okay, let's bring your weight down. You are 89, can we bring it out to 82, 81, then before because pregnancy itself comes with a bit of weight gain, which is natural.
It does.
You know,
does. Okay. All right. Okay. Then let's get into the trimesters.
Yeah.
The first trimester. Okay. What are some of the things that I have to do to take care of myself? Make sure that I don't lose the baby.
Yeah.
Food, because during the first 3 months is the most trying time. Yeah. We go through a lot. And in case viewers you haven't noticed, there's a bun in the oven. So I am particularly interested in this. I have to ask.
That's right.
Yeah.
Yes, of course. So that's a very good observation again. I think you're becoming a gynecologist already. Indeed, the whole pregnancy journey is a 40-week journey, which we divide into 3. So the first 13 weeks, the second 13 weeks, and like that. So the first 13 weeks, which ordinarily people would say the first 3 months, like you said, is the most trying for the woman and for the caregiver or the doctor is the most crucial because that is the time the baby is forming. Okay, so you want to make sure that first of all, once the woman has missed her period, it is crucial that you do your home test. Once it confirms pregnancy, there's no timing which is too early to report.
Okay.
As soon as you miss it, get to see your doctor or your midwife, depending on where you are, because then we'll be able to say, okay, this is what it is, these are your medical parameters, and then you need to do this lab, and then we plan you for the first scan. The first scan we normally do around 6 weeks, 7 weeks, 8 weeks, the earlier the better. And that is purposely to see if we can find where the pregnancy is.
Yes. Okay.
Because sometimes, unfortunately, the pregnancy is formed by it is outside the womb.
Okay. Ectopic.
And that's what we call ectopic.
Right.
Okay. So ectopic pregnancy forms outside the womb, and as the pregnancy is growing 7, 8, 9, 10 weeks, it has a tendency to burst.
The ectopic?
Yes.
Okay.
It will burst because outside the womb the structures are not there to support it. So as it's getting bigger, it will burst. And that's a life-threatening emergency.
Yeah.
It bursts and the woman is bleeding into the tummy. It's a matter of urgent surgery to save that woman's life. So if you scan ahead and you detect it, then we can plan to deal with it rather than waiting without knowing for it to burst and you don't have access to surgery immediately. You're almost losing your life, and it does happen quite often. You know.
Okay. Yeah. I guess it does. It does happen quite often. Okay. So, like I asked, what kind of nutrition?
Yes.
Exercise?
So in the first trimester, you do the scan. Then we confirm the location of the pregnancy.
Right.
Then the counseling begins. We are likely to do a whole host of labs to see what is your blood count. Is what's your blood group? What's your sickling status? Do you have syphilis? Do you have hepatitis?
HIV.
Do you have HIV? All these medical conditions or infections that would have a tendency to affect the baby, or the pregnancy. We check out for all of them, including your blood sugar, your stool. And once everything is okay, we start you off on the basic supplement that you need for the baby's development, which is folic acid. Right? Very, very important. Then the pregnancy hormones will make you feel unwell. You feel weak. You don't feel like talking to people. You feel nauseous. You would vomit. It's perfectly normal to vomit 2 or 3 times. Okay. If it's getting more than 3 times or it's making you extremely weak and dizzy, it means you're losing too much of your body fluid.
Right.
So you would require some fluid support which is why occasionally we'll detain or admit you, give you some drips, sometimes with some vitamins to rejuvenate you, make sure you are well rehydrated, and then you get back on. Takes care of you for a week or 2 or 3, you come back in perfectly normal.
Okay.
Occasionally there may be some coexisting urine infection or malaria, which would make that worse. And so we find out and we deal with all of that. And then we encourage you to take your fruits daily, adequate fluid intake. If the nausea is too bad, occasionally we may give medication to suppress it.
Okay.
And that is first trimester up until the 13th week.
Up till the 13th week. Okay. There's a condition I read about called hyperemesis gravida. I don't is it
gravidarum?
Okay. All
so
right.
it's hyperemesis gravidarum.
Okay.
You want to say that after me?
Hyperemesis gravidarum.
Again.
Okay. Hyperemesis gravidarum.
Beautiful.
All right.
Yes.
I got
so
it.
that is the excessive vomiting of pregnancy.
Mm-hmm.
It's so severe, the woman loses a lot of weight.
Yes.
They're so weak. You need to, like I said, admit, do some IV fluids.
Right.
Yeah.
And then she'll be okay.
She'll be okay.
After the first 3 months.
It's a natural response of your body to the pregnancy hormone.
Okay.
So every person's body takes it differently.
Okay.
Yeah.
Do I exercise during this time, because they say that
first trimester typically no.
No.
You don't want a lot of shaking.
Right.
You know, because if you can imagine the baby's formation, one cell is dividing and has to be at the right place. So a lot of shaking can cause problems where, if you're not lucky, the nose may be located here. You see what I mean? That's the extreme.
Okay.
So yeah, we limit a lot of physical exertion. The good time to exercise is in the second trimester.
Second trimester.
Yeah.
That is why it's totally unwise to stay at home when you find out that you're pregnant and not go to the hospital and have all these checks done, because that's when all those dangers
and advice would be given.
Okay.
Yeah.
So I'm in the second trimester.
Yes.
Baby is growing.
So in the second trimester, baby is growing. Again, you need to have, we do a scan. And that is the time we would tell you that the baby is developing well. We can see the heartbeat.
Yeah.
We can see the position of the placenta. And then we're able to tell a bit also about the fluid around the baby. Everything is okay. And then we're able to even counsel you that you are doing well regarding your fluid and your weight.
Yeah.
You can, so as you can see, the baby in there, and then the fluid around the baby when we do the scan.
Okay, I'm sure that this will be captured pretty soon.
Right.
Yeah, so you go for the scan and they tell you, okay,
good,
perfect.
yes. So that typically is what you see.
Right.
At the time between the first and the second week, or at the beginning of the second trimester, where you see that's the gestational sac, the pregnancy sac. And that's a beautiful baby lying in there, floating in the fluid there. And that's the cord which connects the baby to the mother.
Okay.
And then the black is the water around the baby. So we check for all of that, as well as checking the position of what we call the placenta, the afterbirth.
Yeah.
The placenta is what connects the mother to the baby. And so make sure it's at the right place and seemingly functioning well, as well as check the baby's heartbeat.
Okay.
And then we are good. And then we add a bit more to the woman's supplements and the journey continues.
All right. Okay, that's perfect. So at that time, I suppose that the joy of pregnancy will kick in, because you're probably done dealing with the
first trimester issues, the morning sickness. And then you begin to show a little bit of the bump, you know.
Yeah. Okay.
And as that carries on, around, typically we say from the 18th to the 22nd week, then we do a detailed scan. And that scan, we call it the anomaly scan.
Okay.
Basically to examine the baby in so much detail.
Okay.
Check the brain. Are all the parts formed well?
Right.
Is there any abnormal fluid collection in the brain? The neck of the baby, the chest. Is the heart okay? Is it at the right place? Is there a tendency for a hole in the heart? Is there any problem with the lungs? Check the tummy. Are the kidneys okay? The bladder, the liver.
Okay.
Everything about the baby. Then we're able to also tell about the gender. Is it a baby boy, a baby girl?
Okay.
And then, so we do that detailed assessment, which is crucial.
Okay. That's around what time?
Usually between the 18th to the 22nd week.
That's when you can tell
That's
the
when
sex.
we do that, yeah.
Okay. And all of that.
And all of that. And that's important because if for some reason the baby's formation is abnormal, your doctor and the couple will need to have a discussion.
Okay.
That Mrs. A or couple Mr. and Mrs. AB, this is the problem.
Okay.
We have a baby boy, but the baby's heart is not working well.
Okay.
Or the baby's liver has a problem. The baby has a lot of fluid in the brain. Some of the conditions can be compatible with life.
Right.
Once the baby is born, baby might need surgery to fix it. no problem.
Okay.
Some of them are such that once the baby comes out, takes the first breath, baby is going.
Okay.
So we have a discussion. How do you want to proceed? Shall we end the pregnancy, or would you want to carry it on and we see how it goes?
Okay.
And so that is important. So that if we have to do termination for medical reasons, that is about the best time to do it.
Okay.
It's not so big and it's not so advanced.
Okay.
You are not so attached to it yet and all of that.
Yeah.
And then if there is a need to plan some emergency surgery for as soon as baby is born, that is also discussed. You see, so that the arrangements are made for the baby's surgeon, what we call the pediatric surgeons or neonatologists, to attend the delivery, so that things are planned ahead.
Okay.
Unlike, it's not known. And then you didn't have that scan, you came in labor 1 midnight, by 4 a.m. you've delivered, and they are twins that are joined together.
Oh, yeah. Okay.
You see, all of that could have been detected, and then your delivery is planned.
Okay.
And interventions arranged for.
All right. Okay. Okay. If you just joined us, we are talking about smooth and safe pregnancy and delivery. And I hope you just heard what doctor said. They don't tell us to go for antenatal for fun. Okay. You go there and have yourself checked, and your baby's development and everything, so that you are told what to do if there's something awry. Okay. So let's move on.
Yeah.
At this stage, at this time of the pregnancy, is it possible that if the mother should, you know how you have preterm babies?
Yes.
Would a child at that stage survive?
No, typically in the second trimester, the chances of survival is low,
Okay.
especially in our environment. So that chance of survival is okay, let me say it this way. The number of weeks that the child, when born, would survive depends on the environment.
Right.
Yes. Unfortunately, in our environment, we don't have that level of sophistication to be able to take care of the babies when they are below 28 weeks.
Right.
Okay.
Okay.
So if a baby happens to be delivered at 28 weeks, the average weight of that baby is about 1 kilo.
Yeah.
And so the survival chances are nearly 50%.
Pretty small, yeah. Okay.
Nearly 50%.
All right.
Okay. Before that, we don't consider it viable because it's not likely.
Right.
And somewhere else with a more advanced neonatal intensive support, then from 24, 25 weeks, they are able to survive. Even though very difficult in a lot of cases.
Very challenging.
Yeah.
Okay. All right.
You know, but then from 28 weeks, survival chances are way better.
They're better.
Yeah.
Okay. Okay. So, what about the injections that we have to take through, like the tetanus?
The tetanus, yes. So that also starts in the second trimester.
The second trimester.
Sometime we say we wait till the first movement, or around 16 weeks. And the same time, we also give our women the medication that prevents malaria.
Right.
Yeah.
So
based on some of the labs we would have done earlier, we'll be able to tell who is eligible and who is not. Because not everybody is eligible.
Yeah.
Some have a deficiency of a particular enzyme.
Okay.
So that if you didn't check that and you gave them that medicine, they get a very bad reaction. The whole skin is peeling off, and terribly they have to be on admission. And so we check the hormone, that enzyme first, and then once you do qualify, you are given. If you don't qualify for that particular one, by way of your enzyme deficiency, we give you an alternative.
An alternative. Okay, so to the last trimester, when at that time we start buying our baby stuff, we probably know the sex, so we are doing blue or pink or whatever it is. What happens at that time? Is that time as crucial as the first?
Yes. So
trimester?
if you imagine it as air travel, so the first trimester is the takeoff.
Yeah.
Second trimester you are cruising, and third trimester you are descending to land.
Yeah.
Okay, so third trimester typically from 27 weeks up to 40 weeks. Then you are obviously getting heavier. Your hips are hurting. You know, the hips hurt because of a bit of loosening happens as a result of the pregnancy hormone effects. And then walking sometimes becomes a bit difficult as you approach term.
Yeah.
because what happens is the baby's size is gradually increasing.
Right.
And so in the third trimester, we're around that. It's getting bigger.
Okay.
So the tummy looks a lot bigger, and the baby's position at that point becomes crucial. What happens is that if the baby is in the right position, lying up and down, and the head is down, it's a lot relatively manageable.
Right.
But if the baby's position is such that the legs are down, then there's a tendency that a lot of the movements are going to be in the lower part of your abdomen, and that tends to be a lot more uncomfortable compared to if the head is down. This is what we call breech presentation. Okay, and this is cephalic. The head is so ideally we're happy to have this. A few babies would come with that presentation, and then depending on the size of the baby, depending on the mother's history, whether she has had a previous cesarean, or whether the placenta is at the right place, or whether the water around the baby is okay, we need to decide how to deliver this baby.
Okay.
Whether the mother will be able to push it naturally, or we may have to do a cesarean to deliver that baby.
To deliver that baby. Okay, I had a breech presentation with my first pregnancy, and it was a particularly disturbing time for me because it was two choices. We had to the doctor either had to turn the baby, and if he were to be unsuccessful in doing that, then I'll do the cesarean. But does it not do anything to you? Does it not disturb anything around there? Does it not I was afraid for my child's life, obviously. So
it doesn't really do anything apart from a bit of excess discomfort. Pretty much.
All right.
The other thing is the main concern is the delivery.
Yes.
Because sometimes if it's not detected, you see, and not being detected means the woman was not coming for antenatal, hasn't had a scan close to term, and so it's not detected, so we don't even know that there is the bottom that is coming, we don't know the baby's weight, and then the woman just shows up in labor, you see, then already the leg is coming, stuff like that, then it makes it difficult. Sometimes the woman comes, they've attempted delivering elsewhere with a breech, so the whole of the body has come through and the head is stuck there.
Oh wow, it happens.
It happens.
That happens.
And it's usually a bad thing. Usually does not end well. You know, so based on those criteria, we will decide that this breech can smoothly deliver, or this other one cannot.
Okay. What causes the breech? Is that something that the mother does wrong? Because I thought I was pretty careful.
Yes. So that should tell you that it has nothing to do with you.
Okay.
It's, you know, the babies, they move, they turn from time to time. So up to the baby finds a position that he or she is comfortable in, and then he or she just stays there.
Okay.
Doesn't really care whether it's breech or lying across or no. Baby's just comfortable there. So it's not under anybody's control. The other thing we know is that when women have fibroids, for instance, assuming there's a fibroid which is affecting the lower part of the womb, then the head is not able to fit there well. So the baby is likely to be positioned the wrong way. Or sometimes the placenta is supposed to be from the middle to the upper part of the womb. But if the placenta is in the lower part, it doesn't allow the baby's head to get there. And so the baby is likely to be abnormal in its positioning. Stuff like that. Or if the baby is very smaller than expected, then there's a lot more room around it. So that can also happen, that the baby is so mobile around that by the time we are getting to labor or we are due, the bottom is down. So it's not so much under what you can do or cannot do.
Okay. All right. So it's not our fault when our babies are breech. Okay. All right. Perfect. So at what time in the pregnancy does the baby finally turn to?
Yes. So for most parts, by 36 weeks or 34 weeks and above, baby's position is not likely to change. Okay. So if all through the antenatal we say it is breech, but let's wait and see. Between 34-36 weeks, if the position hasn't changed, chances are that the baby will remain in that position. Then we now have to plan based on, like I said, assuming it is breech, or it is what we call transverse, where the baby is this is twin, where one is breech
and The other
and
is,
one is cephalic.
Okay. Yeah.
So that again, you can see that this is the leading twin. This is going to be the Atta or Terrier. the leading twin, the first twin.
The first one, yeah.
So that one is coming with the bottom.
Okay.
And so it chances are that delivery might be complicated if you allow it normally.
Okay.
So you may need to plan a cesarean.
For that.
But there's some complication where you can imagine this bottom has come out and this head comes to lock with the other head.
Yeah.
That can happen. So in order to forestall stuff like that, you may plan a delivery. Sometimes the baby is lying across.
Yeah.
This is called transverse lie. And in that situation, it overstretches the womb. Okay, and you can't imagine this baby coming down in that position.
Of course not.
So if we are successful at turning it, fair enough. If not, then it have to be delivered through a planned cesarean.
I see. Okay. All right. Is there anything else we can add to the whole period of pregnancy?
We will talk about medications and supplements and nutrition, like we said. So in the first trimester, the woman crucially requires folic acid. From the rest of the trimesters, we may add iron, we may add some vitamins, we add calcium, depending on your needs and what your labs indicate. But a lot of our women have some level of iron deficiency, anemia. So almost every woman would require some iron at some point.
Okay.
So it's good to comply with the medications
you're giving.
Along the line, somebody's blood pressure would start going up.
Okay.
And we say, okay, we need to give you blood pressure medications to control it.
Okay.
You need to comply with that.
Right.
Because that helps to control the blood pressure and minimize the risk of getting complications of the blood pressure. In the greater Accra region, and if you look at the number of women who die as a result of pregnancy-related complications, the high blood pressure-related ones are the leading causes.
Are the leading causes? Oh, wow.
Okay. So blood pressure, high blood pressure and its complications are a leading cause of maternal mortality in Greater Accra region of Ghana. And so basically because the woman does not know she's hypertensive or she's not taking her medication, or when the complications set in, they don't report for care early. You know, a lot of them would wait at home. They get a high blood pressure, they are leaking protein in the urine, their feet get swollen, the whole body is swollen and puffy. Still they don't do anything. And then they start feeling dizzy, headache, they don't do anything. The next thing you say, they have convulsion.
Okay.
Then it's getting bad.
It's getting really bad.
And then in some circumstances, the woman gets convulsion from all these things I have said, and they rush her to the herbalist or to the church house. You see, before they do whatever, another 2, 3, 4, 5, 6 hours before coming to hospital.
The hospital. You will always end up at the hospital anyway, so why don't you just go?
You know, and come and receive care.
The
prayers can be, your pastor can come and pray for you in the hospital.
Of course, why not?
Whilst you're receiving our medical care as well. The other one is the diabetes in pregnancy, which we touched on. So, based on how high the sugars are, there's a place for some oral medication which can control the sugars safely in pregnancy. Others, that wouldn't work alone. And we may have to add injections or take you off the oral one and do the injection straight away. And we counsel you, you'll be referred to see the dietitian to tell you, reduce the portion of your food, eat less carbohydrates, more protein, more veggies. They'll take you through and show you the food portions. Generally, we encourage the woman who is pregnant not to eat a lot of carbohydrates, because it raises the risk of gestational diabetes and the risk of having a very large baby. And so a very large baby means there's a tendency for you to have cesarean delivery, because if it's so big, there's a risk of the baby's birth being traumatic, causing a lot of problem for both you and the baby. Typically, if the baby's weight we estimate on the scan and it's showing it is 4 kg or more, that is a big baby.
That's a big
then
baby.
We need to pause and say, looking at this woman, her pelvis, and this is the first baby, and she's had a previous cesarean, she's had this, can she deliver this? Then we decide and we advise you.
All right.
And so if your blood sugars get so high because of eating the wrong things, drinking sugary drinks every day and doing a lot of carbohydrate, chances are the baby is going to be too big.
Right.
And you're also standing at risk of getting diabetes. So we say on your plate, if you divide your plate into 4, 1/4 should be the carbohydrates, the other quarter should be the protein, the other 2/4 should be the grains and the veggies
and all that. Okay.
And that is healthy.
That's healthy. It is so difficult to follow that,
I know,
because you have cravings,
yes,
all sorts
you have
of
cravings.
things.
So you have cravings that you can direct.
Yeah.
You know, you crave for something. Some crave for the fizzy drinks. We say you can just have a little tiny sip of it. The good thing is most of the cravings, you're not likely to want to consume a lot of it.
All right. Yeah.
Cravings are normal in pregnancy. You know, in the middle of the night, you say, "Oh, I feel for some banku and tilapia at
somewhere,
this junction B
that particular
with that specific
one.
yes." You know, and then your poor husband drives out, goes, looks for it, brings it. You just have a little, and then it's a normal thing in pregnancy.
Yeah.
So when couples come, then we counsel them that these are expected, so that everybody understands. Of course, occasionally the woman will crave for something extremely weird.
Yeah.
Like you crave for alcohol. That's
a
both
no-no.
unhealthy.
Yeah.
Because alcohol tends to affect the baby's brain when a pregnant woman consumes alcohol. And that baby can come out with difficulty learning and all sorts of abnormal behavior. Development.
Yeah, most people don't understand it, because your baby may come out looking perfect, okay, but you don't know the development, the functionally. I'm so glad you talked about this, because it's really important. No alcohol during pregnancy.
And I mean, no herbal medication.
No herbal medication. You know, that's
because
really,
that also tends to, herbal medications are particularly a problem, because yes, the herb might contain something that would solve a particular problem. But you don't know what else is doing to your body.
Exactly.
You know, what effect is it having on your kidneys, on your liver, and then you're pregnant, the effect on the baby.
Yeah.
Okay? So we discourage strongly use of herbal medications during
pregnancy. Okay. All right. So we are done with all the 3 trimesters.
Yeah.
It's time for the D-Day.
Yes.
The birthing process.
Right.
We are at the hospital.
Great.
Okay, in the first place, what sign would you see? What sign would you have before you say you're ready to go to the hospital and to get delivered?
So, in the 3rd trimester, the tummy is getting a lot longer and bigger.
Okay.
And then the woman says, "I feel intermittent pain. I have this pain, the tummy feels hard and painful," and then it goes hard and painful, and it goes. And we say, okay, that is what we call contractions.
All right. Before we continue, let me announce the phone lines. The phone lines are open, so you can call in and ask any question that you want to. Okay, you can call in and ask about the pregnancy, the birthing process, and anything else. Okay, and especially in these times when we are dealing with corona. Hey, you should call us. Call Dr. Hay. He'll give you all the details you need to. Yeah. Okay.
Yes. So then.
We have a caller already. Oh wow. Okay. Hello. Hello. Hello.
Hello.
Yes. Good morning.
Hello.
Hello. Good morning. What's your name and where are you calling from, please? Are you still on? Hello? Okay, we can barely hear you, so if you could please call back, okay? Your call is important. Please try and call back. And when you do call, like we always say, please lower the volume of your set or get a good place to stand so that we can help you, we can have a good conversation. Right, so...
Yes, so that in some people, that's the sign that you are there. The painful hardening of your tummy, what we call the contractions. It comes and goes. It comes and goes. That means that you're nearly about to deliver.
Right.
So when that starts, we expect that the mouth of the womb would also start opening.
Okay.
So the mouth of the womb is closed. It has to open 1 centimeter, 2 centimeters, 3 centimeters. Then that can take unpredictable number of hours to get there. But from 3 centimeters, then it opens at 1 centimeter every hour.
Okay.
So we need it to open fully till about 10.
Okay.
Before the baby's head can come through.
Okay. Does that has to happen before? Okay, we have a caller. Let's hold on. Hello. Hello.
Hello.
Yes. Good morning, madam.
Good morning.
Good morning, Pacho Kasawai.
Hello.
Mitio, Yetio.
Doctor Kasa.
Yo, Pacho Kaswana Kasawai.
Folic acid asante sa wonyoma. Also folic acid. But my would understand me masia. My would the folic acid my
Okay. Yo.
But I'm Mr. Kajan says, no folic acid, the city would be.
Okay.
Na onyima na
Manu they are my
Pacho sisi awonyim. Hello.
But I want
Okay. Yo. Udi akoswana tie why? Wo question na sana. I believe she's gone offline. So
yes.
Yeah.
Okay. So I would know ye didn't know yet me who the money basa Cecilia and Sebe Buanka. I was so would hospital. You better check it. You better scan. You the machine be share was in here who said problem bene woho. Maybe a fibroid be na be pie ho ana say cancer na bit maybe be a this all the ba na ye hwe. Na the woman na ya hwe mama and I want to embassy na ya ma we who treatment.
Yeah. Okay, perfect. Okay, I was going to ask about the fluid that gushes out. Oh,
yes.
What's that called?
The amniotic fluid.
The amniotic fluid, yeah.
So for some, it will start with the contractions.
Yeah.
Others, the water would break.
Right.
Where you just feel a gush of fluid down your thighs, which means that the bag of water around the baby is broken.
Okay.
If that happens when you are close to term, it just means that labor is about to start.
All right.
Even though ideally we expect that to happen when you are already in labor.
All right. Okay, we have a caller. Hello. Hello.
Hello.
Hello, good morning.
Hello.
I can hear you.
Good morning.
Good morning. What's your name and where are you calling from, please?
I'm Emanuela calling from Michelle Camp.
Okay, Manuela, please go ahead.
Okay. When I was about 34, 36 weeks, I was having a huge SFH. But they were still insisting on me doing the CS. And my presentation too was cephalic. So I don't know why they were so insisting on me doing the CS.
Okay. So, but you've had your baby now?
Yes.
Okay. All right. Congratulations. But keep watching, okay? Doctor will answer you.
Right. So quickly, I mean, if the tummy size was so big,
yes, and
we've checked, and it is not just big because the water around the baby is so much, and it's rather the size of the baby. Like I said, if the baby is so big, it'll be safer to consider cesarean. So your caregiver will look at your situation, your history, and what they are finding, and then they will advise you what is best.
Okay.
And then in most cases, once you have an understanding of the risk versus the benefits, then you decide together with your caregiver what is best for you and the baby.
Of the baby. Okay, perfect. I hope she's answered.
Yeah.
I hope she's because someone has to decide what you need. Okay, we have another caller. Hello. Yo, sister.
Hello.
Hello. Please, Hello. Hello? Hello?
Hello?
Pacha Bo, hello? Baby, I'll offer a fee. Why?
Because your friend Ramatu.
Okay. Ramatu Pacha Kasa, why?
Pacha, okay. I'm a minimum agreement for Chile. I'm a minimum agreement. But I think that we need to answer. We need to
Okay. All right. Ramatu, sorry, sir, what situation I sir, but Dr. Wohanti, keep watching. Why? Because one actually, Obama, why? Okay, I believe, yeah.
Yes. So she's talking about she had a termination.
She did a termination.
And after that, she keeps losing her pregnancies.
Yeah.
And Ramatu, a termination in Ama, I wouldn't have no problem be about. And now so say, ama infection be akora womb nemu, and now was see, and no, a be me to me just a problem. Until a bar, would the hospital, would the call hospital, you all the checks, problem now, what on, now show more amount, and your problem, solution anyhow.
Okay, okay, all right, okay, that's perfect. So we have another caller online. Hello. 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 I do not know what is up with the phone lines today, but if you are still there and you can hear me, please call back. Probably that's why we are not hearing you too well. And when you call, lower the volume of your set, please. It helps us hear you better. So I was talking about the amniotic fluid. That happens before
for some people, yes, ideally that should happen when you are in labor.
All right.
But occasionally for some people it happens before the labor starts. When that happens, you need to quickly get into your hospital. Because if sometimes the cord can slip past if the waters break and the baby's head or the bottom is not fitting the pelvis, and that can be a bad emergency for the baby.
Okay. Hello, we have another caller. Good morning. Hello, madam. Good morning. What's your name?
Hello,
I can hear you. Good morning.
Hello.
Oh my God. Hello. Oh, I don't know what's going on today, but I believe we lost that caller as well. I think maybe the phone lines may be jammed or something is wrong somewhere, but whatever it is, just please keep your calls coming and don't stop calling. We will have someone. Yeah.
Good. Yes. And then so in some other women, the only sign they see is bleeding.
Yes.
Right. And so it is usually not normal to bleed at any point in a pregnancy.
Yeah.
It is abnormal.
Okay.
So at any point in pregnancy, be it first trimester, second trimester, or third trimester, when you see bleeding, there's no business to stay home.
At home, yes.
You need to rush to the hospital. Yeah.
Okay.
So if it is in the last trimester or towards term, it may be what we call a heavy show.
Okay.
But that is not up to you to determine.
Right.
You need to get to the hospital. Occasionally it's the placenta which is peeling off.
Okay.
Or the placenta is at the lower part and it is beginning to bleed. This can be potentially life-threatening emergencies.
Wow.
So when that happens, get to the hospital.
Okay.
We would assess, check you, and then we're able to determine whether you can have a normal delivery or not.
Okay. Hello, we have our last caller. Hello. Hello. Yes, hello, good morning.
Good morning.
Yes. What's your name, please?
Good morning. This is Claudia from...
Please lower the volume of your set, please.
This is Kasa from... This is Fauzia from Kasua.
Okay, Fauzia, if you've lowered the volume of your set, you can go ahead.
My problem is I'm pregnant and I left it 3 months now.
Okay.
But I have been feeling some dizziness, and when I went to the hospital, they gave me some medication plus some blood tonic. Okay. But with the blood tonic, whenever I take it, I feel dizzy. I won't do anything. I'll be sleeping until evening.
Okay.
So I'll stop taking the medication. So I want to ask the doctor whether it's normal or I should continue with that blood tonic, or I should see the doctor to change the blood tonic for me.
Okay, Fauzia, thank you so much for your question. Thanks for sharing that with us. So keep watching. Doctor will answer you, okay?
Good, yes. So, I mean, it is good that you went to the hospital, and then they would have detected that your blood level is low, which is why you needed a blood tonic. So if you are reacting to one particular one, when you get back, there are a whole host of different ones that can be. So you'll be given a different one, which is less likely to make you dizzy.
Right.
So get back to see your caregiver, and they will change it for you, most likely, and you should be okay.
You should be okay.
Yeah.
All right. I hope Fauzia heard that, and she'll take care of herself. Go again. Okay. Wow. I'm hearing that we are hard pressed for time. I had a little bit more to talk about, but you just let's summarize everything. Let's end with Corona.
Yes.
I am especially worried because if Corona doesn't end,
I know, but Corona would end. We are hoping and praying
that it would.
Like, we are fasting and praying today.
Yes.
Because we do all the human efforts, but we also have to trust the owner of the world to intervene, isn't it? Yeah.
That's true.
Good. So, Corona is a new virus which is causing trouble all over the world. Started off in China. And so China is our biggest test case. And so far, about 9 people had a corona and delivered when they were pregnant.
Okay.
And so in about 7 or so of them, they had a delivery and the babies tested negative, even though the mothers had the condition. Okay. And then in 2 cases, the babies tested positive.
Okay.
And so the scientific analysis is beginning to look as though it did not come from the mother to the baby during the pregnancy.
Okay.
It's most likely after birth.
After birth.
So the close contact.
Okay.
And so we are still monitoring, but that seemed like what really did happen in those 2 cases.
Right.
But generally, the pregnant woman is not at any higher risk than the non-pregnant person. Okay. So that pregnant women don't necessarily get alarmed about it. No. The same general precautions of your hand hygiene, wash your hands as often as you can. And if you don't have running water and soap, use the alcohol-based sanitizers as often as you can. And then avoid a close contact and avoid where there are gatherings.
Yeah.
The other thing that helps is the pregnant woman, generally, we encourage good nutrition.
Right.
Eat well. Adequate fruits. Every day, take some fruit. Every day. And then take some vegetables and drink enough water and adequate proteins. Okay, these would help to boost your immunity generally and make you fit, so that should you even get the COVID infection, it's not a big deal.
Right.
Your body will be able to deal with it.
Okay.
So those precautions are good. And then the pregnant woman is not at any elevated risk. So don't be too anxious and alarmed and worried. No. Okay. What may happen is, if a pregnant woman gets it, then and delivers, we would then have to decide whether she should breastfeed or not. Chances are that, because we want to limit close contact, if the option is to breastfeed, we may have to encourage the woman to express milk. Of course, having washed the hands very well and washed the bottles, express, and baby is fed, and then we should be fine.
Okay, so the corona doesn't affect the milk production?
No,
it doesn't.
So far, it doesn't seem like it affects the baby through pregnancy or the breastfeeding.
Okay.
The effect may be through close contact, not through the body fluid.
Okay, but to be on the safe side, I mean, I'm a little pessimistic about this because I'm scared. But to be on the safe side, can't we just do the formula till the mother is well?
So we will discuss.
Okay.
We will discuss. There's one mother who can afford the formula.
Right.
There's one who cannot.
Who cannot.
There's one who cannot. or who can, but you are concerned about hygienic practices, baby might get a bad tummy infection, bad diarrhea, sepsis, and baby will die because of improper feeding. So we look at every woman's situation and we agree on what best would work for them.
Okay, we have to go right now. So you have to give your numbers out and tell us where you're located. And then after that, we say a short prayer for Ghana.
All right. Yes, so pregnancy can be smooth and safe with smooth delivery once you receive your preconception care and follow the instructions and the guide we give you in the course of the pregnancy. Avoid alcohol, take your supplements, take your blood pressure pills, whatever we prescribe for you. It's all in the interest of having a smooth pregnancy that is healthy for both you and the baby. And if it comes to delivery and we offer that it is cesarean that is likely to work best for you, don't say to Fiakwa, my pastor says no knife should touch my body. No. That is what would work for you. And so we guide you to have the best outcome. And Corona, keep safe and keep healthy. Eat well. Your hand hygiene, if you have to sneeze, cover your mouth, your nose with tissue, and after that you drop it in the bin. Don't put it back in your pocket or your lady's bag.
Okay. Then your numbers?
Yes, so our is at Latibio Koshi, the Shape Healthcare.
The Shape Healthcare, okay. Shape Healthcare is located at Latibio Koshi, second Latibio Koshi Road, Accra, Ghana. That's what we have here. And then the numbers to call are 0302 631 880. 0302 631 880. And then there's another number, the 054. 926 2100. 054 926 2100. Okay, so you call these numbers and then you will be directed to Dr. Promise sefogah. You have to make an appointment before you get to see him. All right, so that's for Shape Healthcare. So finally, Doc, I would want, up next we have what do we call it, sort of a worship session, but before we end, let's say a short prayer for
Ghana. Who prays, me or you?
You do.
Okay, let's pray.
And that is your camera.
Okay.
No, that's your camera.
Yes.
Sorry, that's your camera right there. I'm a little confused this morning. Okay, so you look into your the camera and then you say a prayer with us.
Okay, so our Father, we come before you on behalf of Ghana, the people of Ghana, the leadership of Ghana, and the leadership of the whole world. The Bible says that the earth is the Lord's and the fullness thereof. You created the world and you founded it upon the waters. So your world is sick of COVID-19. You are the best person to heal your world and our world. So we come back to you. We are helpless as human beings, but we know that you are a God for whom there is no impossibility. So as we do our human efforts, we pray that just one breath of freshness from you would clear this virus from the whole world. And that is what we are trusting you for. We know you've done great miracles we read about. You parted the Red Sea. You held the sun up. You did so many things that we recount and which we know. And so we believe that you are capable of helping eradicate COVID-19 from the world and its history. Today, as a nation, we lay down our stomach to call on you, because we believe that you are God who answers us when we pray. Heal our land, bless our land, and keep us safe and healthy to the praise and glory of your name. In Jesus' name we pray, dear God. Amen.
Amen. Amen. Thank you so much, Doctor.
Thank you.
Thank you so much. Up next, of course, is Be Made with Infocus, but it's also a time to worship. So do not miss this. Stay tuned. Don't go anywhere. We will be back.
Good morning to you. It's so nice to see